So our speaker today is Oliver Backhouse. Oliver is Vice President for Strategic Partnerships in R&D at AstraZeneca. His remit there, just a small little remit that he's going to be talking to us about today, just a little one, is reimagining healthcare. Immediately prior to this current role, Oliver was in precision medicine in R&D, where he developed and implemented strategy for AZ's companion and complementary diagnostics. He also helped to establish the population genomics group. Before this, Oliver worked in various commercial and strategy roles at AZ, including as commercial head of global antibiotics, country president in Malaysia and Singapore, and head of corporate strategy. Prior to AZ, Oliver held various commercial and strategy roles in big pharma, biotech at GSK, Novartis, and Chiron. He was also on the public sector side in the UK as a policy advisor at Number 10 in the early 2000s and a consultant at McKinsey. He's just told us actually that he's in the process of studying for another degree. He already has a master's degree in business, cancer and therapeutics, and mathematics. So he probably needs another, right, Oliver? Outside work, Oliver is a keen tennis player where he tells us his enthusiasm is increasingly exceeding his skill level. I can't believe it. So, Oliver, over to you.
Nick, thank you. Thank you for the introduction. I wasn't sure who you were talking about right up until that last sentence, and then it was clear that it was me. Hi, everybody. Delighted to see you, to meet you. As Nick mentioned, I'm just going to share a bit about the role that I've got at AstraZeneca to reimagine healthcare. Before I do, I did also just want to say a huge thank you to the Five&Co team who've been fantastic in sort of setting this up. So Ben I've worked with especially, but also Nick and Jane and Tim. So big thanks. And I think this idea of bringing people together from across the industry is fantastic. I tried really hard to do this without slides, but then but it turned out I've just to help out, I've put a few slides together just to help the conversation flow. So hopefully I'm looking at Ben. Hopefully Ben can get us going. Yeah. So just some segments to hang the topics off, if you like, and to focus on this idea of enterprise leadership to reimagine healthcare, or in reimagining healthcare. Just going to say a bit about how it all started, and mention it's tinged with a great deal of sadness, I'm afraid, but mention Jose Baselga. Talk about an example that's underway in the UK in order to do this, to achieve this lofty goal of reimagining healthcare. Talk a bit about future opportunities, and then share some reflections, some observations about actually making this happen. As I say, this is my day job, so I'm living it, and share some observations, about getting it done. So Ben, yes. Now, just starting here, as I say, unfortunately, it's with a great deal of sadness that I start the presentation here. I don't know if people know Jose Baselga, but he was our head of oncology for R&D, and he was my main sponsor for this work. People may know he was one of maybe the leading medical oncologist in the world. But very, very sadly died in March this year, unexpectedly, very unexpectedly, at the age of 61 with Creutzfeldt-Jakob disease. And it's been a devastating loss for the company, but I think really a devastating loss for the oncologist community, the medical community, and patients really as well, worldwide, because one of the things that Jose had was just an unquenchable passion for patients and for improving care in cancer. People may know he spent the large part of his life, his career at Memorial Sloan Kettering, so one of the leading oncology centers in the world, as the physician-in-chief. He was Catalonian. He also spent time at the institute, the Vall d'Hebron Institute in Barcelona. And sadly, he left. He was married for 30 years. Sadly, left 4 children. So, just to recognise Jose, and that this work really started. This work at AstraZeneca really started with him. This is from a paper that he wrote. So this is his vision to cure cancer. And when we talk about reimagining healthcare, this is really the framework. There are other therapy areas that we're involved in, but in oncology, this is really the framework that we're using, that we're basing everything from. And the curing of cancer is this idea, is sort of the embodiment of this idea that we reimagine healthcare. Just to talk about the sort of two paradigms, you can see on the left there, the current paradigm of cancer is really a progressive tumor burden, increasing over time, briefly halted by various different interventions, but ultimately tumor burden increasing, driven by various mechanisms of tumor resistance that you can see there. So then the potential solutions here being significant, so being much earlier detection and interception of the cancer, deeper, more thorough response is the second there. Therapeutic monitoring, ongoing therapeutic monitoring and interventions, adaptive interventions, and then also digital. There's a digital piece here around proactive monitoring as well. Leading to, hopefully, those solutions leading to that much different tumor burden that you can see there, with an initial very early diagnosis through some method, but here we've mentioned blood-based screening, so circulating tumor DNA. But then, as you can see there, a very flat tumor burden profile, offering the promise of long-term survival and of cure. So I'd ask you to think at this stage, really what could the impact of achieving this vision be, achieving this very different tumor burden profile and really aiming to cure cancer across tumor types and, potentially around the world. So, just to think what the impact of that could be. Okay, so moving on to an example. So that's all theory, if you like, so far, but moving on to an example. And what we've got here are the survival rates, the 5-year survival rates. This is from the Lancet from a couple of years ago, in the UK over the last 25 years, 26 years. And as you can see, the 5-year survival rates are improving, but they're still significantly worse than international comparisons. So, I mean, I'm sorry to say, and I think there is good recognition of this, that the UK is one of the worst performing, certainly developed countries in the world in terms of cancer survival. Certain cancer types are doing okay. So melanoma and breast are nearing cure. So they're up to sort of 85 to 90%. But some cancer types, lung, we've pulled out here, which is down in the sort of 10–15% range, and hasn't really moved much over 25 years. So, the idea here is to completely change this paradigm, to massively transform outcomes and survival for cancer patients. This ties into, and I should say, this is sort of the first project that we've worked on to achieve this goal of reimagining healthcare. It ties in very closely with what the UK itself is trying to achieve in cancer. So you see on the left here, the long-term plan for cancer, which was written in 2019, also about 2 years ago. And the overarching goal for cancer in the UK is to detect cancer earlier. So there's a lot, there's a lot of things that are, not working perfectly, but the key intervention is early detection, much earlier detection, and early treatment. So the NHS in the UK has set itself the goal of diagnosing 75% of cancers early by 2028. It's currently at around 50%. So there's a very, very long way to go. But if that were to happen, then at least 55,000 more people each year would survive for 5 years or longer. So again, I'd say, imagine what the impact of this could be in the UK, but also around the world, because, the cancer survival rates are not so different. Although the UK is a bit worse, they're not so different around the rest of the world. So what could be the future opportunities? I mean, this is a sort of a generalization. I mean, what I've just described is the specific project that we've been working on first. And going back to Jose, I mean, how this all started was Jose sort of confronted me one day in the office. This was in the days that we were in the office, and he said, "Look, I've got a project for you. How do you fancy, reimagining healthcare?" And it started with the UK oncology project, but also just trying to generalize, what the future potential for this could be. So we are, I think, in the realm of moonshot type territory, where you say, look, where is the major unmet medical need? Where could we transform survival and outcomes, so have a major impact on outcomes? And it's also including not just therapies, but also technology through partnerships. So we've sort of summarized it there, reimagining healthcare. So transforming medical practice and outcomes for patients by partnering broadly, so by partnering with healthcare systems and breakthrough technology providers, potentially globally. So that's the vision for the future, really, and for us for reimagining healthcare. As it happens, it's just, as Nick mentioned, it's just me working on this in the company. So I've been in roles where I've had big teams, resources, things that I can sort of do, but in this role, that's not the case. So there are some constraints some working constraints in actually getting this done on a daily basis. I've mentioned a few here. So and I think the point here is that all of these have to be true. So to be able to do this, it's not one or the other or the other or the other. It's and, so it's the first one and the second one and the third one. So it ends up being quite a series of constraints to get this done. So the first is that we're in moonshot territory. We're in step change territory. So 10x, however you want to describe it. So it's significant improvement, massive improvement versus just incremental improvement. The second thing is it's not some kind of theoretical project for the future. It's got to happen now. So these things, the technologies, the circumstances, the environments, they have to be in place now. The third thing, and I guess a lot of people on the call may appreciate this, it's also got to be something that no one else is currently working on, because otherwise, it's sort of happening somewhere else in the company. And in a big pharma company of 75,000, it's not so easy because my usual rule of thumb is someone's working on exactly the same thing that you are somewhere else in the organization. So it's not so easy to find these things that no one else is working on. And then the fourth point is that also no one has spotted, or at least not thought possible. I've discovered this. It has to be something that pharma can do. I mean, it's in my case, maybe it's possible to shift the pharma company to do something other than its core business over time. But again, in the short term, in the immediate term, it has to be something that pharma can do. And I've sort of maybe slightly glibly summarized what pharma does here in terms of making noise, by which I mean the commercial organization, or running experiments, by which I mean the R&D organization. And then the final thing is that all parties need to be aligned, or at least have common interests in the key areas. And that this is not so simple either, given that we're often talking about very different types of institutions or organizations to make this happen. So in the example that I cited, the UK example, we're talking about the UK government and the government department, so Office for Life Sciences, Department for Business, Department for health and social care. We're also talking about a big pharma company, could be AstraZeneca, might be GSK, could be somebody else. But then we're also potentially talking about startups and early stage technology companies, that are very, very different types of institutions and organizations. So at the very least, there has to be a common interest in terms of the vision that's being achieved. So there's my sort of initial thoughts. Nick, I think over to you. But yeah, just to make the introduction now.
Thank you, Oliver. I'm sure there's going to be lots of questions from people just about exactly what you're doing, and I know you've got some great examples of how you're delivering within those constraints. But look, let's just explore one thing for a moment, if we can. That's all well and good, isn't it? You're there on your own. You've been handed this brief, which is how to cure cancer. You were given this challenge of how do you fancy reimagining healthcare? What sort of mindset do you need as a leader, Oliver, to do all of that? We often talk about people needing an enterprise leadership mindset to think beyond their function. Interestingly, you don't really have a function here that you're tied to. Thinking beyond your function, thinking and facilitating across the organization, thinking about the organization as a whole rather than a function. And oftentimes people talk about stepping into the unknown. How much of all of that chimes with the mindset that you think you need to deliver against this?
Well, Nick, it's a great question, and I mean, again, I'm afraid a sort of very sad question because, you know, I took my lead very much. I mean, this came from Jose, and I think what he had in AstraZeneca, and it was probably unique, was this true enterprise mindset, true enterprise sort of leadership perspective, and what drove him was, I mean, of course, in his day job, he was developing medicines that the company can sell. But what really drove him was sort of research insight and this idea of curing cancer. So I think, you know, the enterprise mindset there was almost as broad as it possibly could be. I mean, it was certainly beyond the company and included sort of populations. It included healthcare systems. It included technology. So well beyond the organization. And I have to say, I think he's, you know, people have got their day job, so it's hard to say. But he was certainly my sponsor in terms of enterprise leadership. And I've tried to take my lead from him. I mean, he really, for me, created this context for growth. And I do, you know, sadly, as he's died now, I mean, I do see it as something of a personal mission and a sort of legacy, really, sort of continuing his legacy to try to envision what he had imagined. And I should say, I didn't know him that well. I mean, there were other people in the organization, our CEO and others, who'd known him for his whole career. And you know, in the sort of memorial service that we had internally, I mean, it was very, very moving. You know, people spoke about him and how they started training with him. And I only worked with him for the last year or so on this piece of work. But yeah, just incredible passion, drive, infectious enthusiasm to sort of make things better and be very, you know, really think about patients and how to improve care and how to improve treatment. That for me was exceptional. And I should say he brought something different to the company from everyone else. We didn't have a medical oncologist. So our other head of R&D is primarily a scientist. We've got commercial folks. We didn't really have a clinician, a medical oncologist with a sort of reputation and standing sort of globally. So he brought that sort of functional expertise as well, alongside this incredible sort of behavioral, you know, passion.
So you're inheriting that legacy, really, Oliver, that you talk about, and clearly that's a leader that you want to follow and follow in his footsteps. What sort of thing do you find yourself doing to make progress in your goals to reimagining healthcare? Because on your own, how much can you actually achieve? And how do you go about that? You know, assuming you embrace that enterprise leadership mindset, how do you go about making progress? What are the key things that you do? What behaviors?
Well, and Nick, well, absolutely. And I mean, just to pick up on that, one observation is it's actually, you know, again, I'm a single person. There's every risk that I just get completely crushed. You know, right. one day somebody says, "Oh, that was a ridiculous idea. Like, why are we even? You know, why are we even? What? Like, we're drug developers, and get involved in the occasional vaccine, but we need to get organized around, developing and selling our new products. So there's every chance that I could get sort of completely crushed. There's a real fragility, and along with the sadness, the deep sadness and loss in losing Jose, I've also lost my key sponsor at a senior level. So honestly, a massive part of what I have to do is try to find and by the way, the rest of the organization isn't necessarily behind this, right? It's not obvious. Because it's not obviously a thing a pharma company should do to get involved in sort of, you might call it public health. I mean, it's not obviously the core mission of the organization. So I'm trying to find sponsors or other sponsors, senior sponsors all the time, advocates, internally, externally, sort of think about those dynamics to sort of not just disappear down a big sort of plug hole. That's really and then also try and co-opt people in the organization to do stuff. So again, I don't have any direct authority over anyone. So so we're working with the clinical teams, working with the precision medicine teams, working with the commercial teams. It's a case of both sort of beg, borrowing and stealing, but also trying to get them to do stuff. And of course, it was historically through proximity to one of our senior leaders. So it's trying to co-opt people in the organization as well to do stuff. And these kinds of projects, they involve a lot of people. So if I think about internally, there's upwards of 50, 60 people, 70 even, involved in this that I need to work with. And just in the UK, if I think about externally as well, it's probably a similar number. So there's a lot of that kind of, you might call it ultra stakeholder management or ultra, sponsorship management.